Okay, students, we're going to go ahead and start up on your 210 facial bones, nasal bones, and zygomatic arches. So when we're looking here at the facial bones, there are 14 total in number. So we're looking at rights and lefts, and it's the biggest error that you guys make when we say, okay, label the facial bones. How many are there? You guys are missing either the right or the left, so make sure that you understand that there's two. So there's 14 in number. There's a right and left nasal, right and left lacrimal, right and left maxillary, right and left zygomatic, right and left palatine, right and left inferior nasal concha. There's one vomer and one mandible. So if we're looking here at the facial bones, I always start over here. So we have the left nasal, so this is left, that's the right. We have the left lacrimal, the left zygomatic, the left inferior nasal concha, the left maxilla, and here's your mandible. So here's your mandible, your maxilla, your zygoma, your nasal bone, and your lacrimal bone deep in there. Okay, we have your optic foramen, your lacrimal bone, your ethmoid bone deep in there. We have the infraorbital foramen with your inferior nasal concha. We have the superior nasal spine, or what we refer to as the canthion. This is your maxilla, this whole pink bone. This is your mandible down here. Your vomer is just a small little piece that sticks up, and we'll show you on a lateral image of that. And then you have your inferior orbital fissure down below. So you have your superior orbital fissure with your inferior orbital fissure with your optic foramen right there. Here's another lateral, so you can see your nasal bones here with your lacrimal bone and your ethmoid bone. So ethmoid, lacrimal, and then you have your maxilla. So your zygomatic here, you have your EAM with your mandibular condyle. You've got your goyon or your mandibular angle, I don't care which one you call it. You have your mandibular notch with your cornoid process, that's the anterior. You have your mental foramen, so just the mentum, as you know, is the point, and then you have your foramen, which is an opening. So you have an alveolar process. So the alveolar process of your maxilla is where the roots of your teeth are. You also have an alveolar process of your mandible, so it's on both sides where the roots of the teeth are. You have your temporal process here, and you have your anterior nasal spine, which we refer to as the canthion. So your nasal bones, they're two small thin bones. They vary in size and shape on everyone. From superior bony wall of the nasal cavity, commonly called the bridge of the nose. They articulate with the mid-sagittal plane, so superiorly with the frontal bone, posterior superior with the perpendicular plate of the ethmoid bone, and on each lateral side with the maxilla. Now you can see here we have your nasion, which is right here, your lacrimal bone, your ethmoid bone deep in there. You have your left and your right nasal bone, and this is the frontal process of your maxilla. So I'm going to hold you to it. You're going to have to know that that's your frontal process of your maxilla. So your lacrimal bones, they're the two smallest bones in the skull, located anterior part of the medial wall of the orbits between the labyrinth and the ethmoid and maxilla. Each bone contains a lacrimal foramen through which your tear duct passes, so that's where you cry from. The articulation, so it communicates with the frontal bone, ethmoid bone, maxilla, and inferior nasal concha, so quite a few. Your maxillary bone, so it's the largest immovable bone of the face. Each articulates with each other, with other facial bones except for the mandible. Also articulates with the frontal and ethmoid cranial bones. So they form part of the lateral walls of most floor of the nasal cavity, and they form part of the floor of the orbit. So there's a right and left, so there's two, so don't miss that. You have your left maxilla, your right maxilla, and you can see this is the body here. So we have the frontal process, the zygomatic process, the body, the velar process, the canthion. So the canthion technically is right below the anterior nasal spine. So we pretty much just refer to this as the canthion, but technically the canthion is here and the anterior nasal spine is there. So the pointy part is the spine. All right, so here's your frontal view. You have your frontal process of your maxilla, your zygomatic process of your maxilla, your alveolar process of your maxilla, and then these darker purple are your frontal sinuses, or frontal maxilla sinuses. Jeez Louise. All right, so they form 3/4 of the roof of the mouth. They have a zygomatic process that articulates with the zygoma to form the cheek. The body contains large pyramid-shaped cavity, which is called the maxillary sinus, and the infraorbital foramen located under each orbit for passage of infraorbital nerve and artery. So, the alveolar process is the inferior borders of the spongy bone that supports the roots of the teeth. The anterior nasal spine is the forward pointed process at the midline junction, and the canthion is the mid point of that junction. So, your zygomatic bones. They form the prominence of your cheek, and each person is different on how far that sticks out. And when we get to the zygomatic bones, we'll talk about that because sometimes they're really, really hard to get good zygomatic arches. So they form part of the side wall and the floor of the orbit, and the temporal process extends posteriorly to join the zygomatic process of the temporal bone. So the zygomatic arch is formed by the union of the temporal process of the zygoma and the zygomatic process of the temporal bone. You're going to have to tell me which bone you're talking about when you're talking about anything to do with the zygomatic, okay? So they articulate superiorly with the frontal bone, laterally with the zygomatic process of the temporal bone, anteriorly with the maxilla, and posteriorly with the sphenoid. So you can see here we have your zygomatic arch of your temporal bone, and you have the zygomatic arch of your zygoma. So you have your zygomatic prominence, this is the part that sticks out the most, and this whole thing is your zygomatic bone. This is your maxilla. So just to review one more time, we'll take a look at this. We've got the EAM, and we have the mandibular condyle with the mandibular notch, with the coronoid. Down here we have the angle of the mandible or the goyon. We have the mental foramen. We have the alveolar process of the maxilla with the alveolar process of the mandible. We have the acanthion, and then you have your anterior nasal spine. Coming up, we have your ethmoid, which is the one further back, your lacrimal, which you have a duct for tears, and you have your frontal process of your maxilla with your nasal bones. All right, be able to label that. Palatine bones. So they're two L-shaped bones composed of vertical and horizontal plates. So the horizontal plates articulate with the maxilla to complete the posterior fourth of the bony palate, so the roof of your mouth. Vertical portions extend upwards between the maxilla and the pterygoid process of the sphenoid in the posterior nasal cavity. So the superior tips of the vertical plates assist in forming the posterior medial orbit. So that little teeny speck in the orbit, and we'll show you that when I get to the orbits. So here we have the left palatine process of the left maxilla, and we have the right palatine process of the right maxilla. Then you have the horizontal portions, so these are the vertical portions, this is the horizontal portion, so you have palatine bone horizontal and the palatine bone, so you have the left and the right, and then you have the pterygoid hamulus of the sphenoid, that's what that is, hanging down there, okay? So here's the same one we just labeled, so looking here at a sectional mid-sagittal section, well actually it's probably not mid-sagittal, it's cut over just a little bit. You have your crista galli, and you have your superior nasal concha with your cribiform plate right here underneath the crista galli. You have your sphenoid bone, which this is your sella turcica. You have your sphenoid sinus and your clivus down here. So you have your vertical portion of your palatine bone. Okay, so this right here is your inferior nasal concha. So inferior, middle, and superior nasal concha. And then you have your palatine process of your maxilla here. Your inferior nasal concha, what is that? Extends diagonally and inferiorly from the lateral walls of the nasal cavity at its lower third. So it's a long, narrow, thin bone with a lateral curl. It gives a scroll-like appearance. So the upper two nasal concha are processes of the ethmoid bone. Okay, so the upper two are part of the ethmoid bone. So here you can see you have your superior and middle nasal concha, and they're on your ethmoid bone, and you have your inferior nasal concha, which is its own deal. So you can see the superior and the middle nasal concha, part of the ethmoid bone, and then you have this free-floating bone, which is your inferior nasal concha. You have your vertical portion of your palatine bone here, and there's a piece of it right there, and then you have your palatine process of your maxilla. So be able to tell me which bone the superior middle nasal concha on, is the inferior nasal concha part of another bone, or is it its own deal? And the horizontal portion of the palatine bone communicates with what, along with the palatine process of the maxilla. So your vomer. So what is the vomer? It's a thin plate of bone situated in the MSP, so mid-sagittal plane of the floor of the nasal cavity. It forms the inferior nasal septum. So it's the lower portion. When I show you a picture of it, you'll understand what I'm talking about. So the superior border articulates with the body of the sphenoid. The superior part of the anterior border articulates with the perpendicular plate of the ethmoid. So the posterior border is free. So we see here, this is the vomer here, and it's like a shovel. It's like a snow shovel. So this is the vomer right here, and this is the perpendicular plate of the ethmoid. This up here is septal cartilage. So this is the softer part. So here's your nasal bones. So the vomer is right there with your maxilla. So you've got vomer, perpendicular plate of your ethmoid, and cartilage. So your mandible is the largest and most dense bone of the face. The body is curved, horizontal portion, the rami, the two vertical portions on each side of the body, and the angle of the mandible, so equals the junction and body of the ramus, also called the goyon. So I don't care if you call it the angle or the goyon, it's up to you. The mental protuberance is anterior triangular prominence, so your chin. So the symphysis is the most anterior and central part where left and right halves of the mandible come together. The velar process is the superior border of the body, consists of spongy bones that supports the teeth. So there's the alveolar process on the maxilla and alveolar process on the mandible. So the mental foramen is the small opening on each side of the second premolar. So it has nerves and blood vessels that come through there. The coronoid process is the anterior process of the top of the ramus, and the condylar process is the posterior process at the top of the ramus. So it articulates with the mandibular fossa of your temporal bone to form the TMJs. The mandibular notch is a concave area at the top of the ramus between the coronoid and the condylar process. So looking here, we'll start to label off to the side here. We have your coronoid process with your ramus, and then we have your body and your symphysis where the two sides come together, the left and the right. You have the mental foramen, you have the angle or the goyon, and you have the neck. And so this is a condylar process. You have your neck and your condyle. The velar process is right there along the roots of the teeth. So coming around here, we have the neck, we have the condylar process with the mandibular notch, with the ramus, the goyon, the body, the mental foramen, the mental protuberance. You have the symphysis where they come together, and the velar process along the teeth. So the hyoid bone, it's a small U-shaped bone situated at the base of the tongue. So a lot of you, when you're labeling and you're giving me all the bones, you're one short. You can't figure out where that one short bone is. It's a hyoid. Don't forget the hyoid. It's an accessory bone of the axial skeleton. It's not a facial or cranial bone, so I'll have you put it in with the facial bones. The only bone in the body that does not articulate with another bone. So I'm just going to ask you about it. See if you know about it. So you have the greater cornu and the lesser, and you have the body. Very simple bone. We're going to learn more about that when we get to sectional anatomy. We're going to talk about all the different muscles that attach to it. So let's cover the orbits. So each is composed of 7 bones. There's the frontal, sphenoid, ethmoid, maxilla, zygoma, lacrimal, and palatine. So be able to label this orbit. You're going to see it multiple times. It's not going away. So you have your greater wing of your sphenoid. There's your palatine bone right there, that little blue one. You have your zygoma, you have your maxilla, So all right in here, you have the orbital surface of your maxilla. It's in the orbit, right? So the orbital surface of your maxilla. You have your lacrimal bone. These are your nasal bones right there. Here's your ethmoid, and here's your frontal. So superior orbital fissure, inferior orbital fissure, and there is your optic foramen going through the middle there. So this is your orbit. So what I'm going to do is I'm going to stop there, and I'm going to end this one. So it's about 15-16 minutes long, and then we're going to start up again with the procedures so that you can study the anatomy separate from the actual procedures. Okay?